All right, guys, let's try this again. I am live from my phone now. The visual quality is not as good. However, um, hopefully the service isn't as choppy. If it is, I'm just gonna have to wait until I go upstairs. So as you guys come in, just let me know how it sounds. And if it's still bad, I'll just go live when I go back upstairs. Let me know, guys, as you come in, how it sounds. I just had to end the other live. Hey, I always forget how to pronounce that. Protactinin. Hey, Kayla. Hey, Natisha. Let me know if you guys can hear me. Okay, so you can hear me. I was just live on my computer and I had to switch over to my phone, and that was such a blower because I just got this new computer that I can't even use right now. But my service downstairs is terrible. Okay. Chantel says it sounds way better. Okay, guys. So for those of you that's joining from the other stream, welcome back. Hey, Stephanie. Thank you guys for coming over on to this one. So do me a favor, guys. Let me know if you happen to have any questions or any updates you guys want to share. Shari says you sound so much better. Good. I'm mad because I'm on my phone. I didn't want to do this on my phone. I wanted to be on my computer. Matter of fact, let me show you guys the computer. So I just got this computer. I'm in my kitchen right now because I'm getting my space painted that I'm going to set my desk up in. And so I'm in the kitchen. Okay, from Johns Creek, I can hear you. Is the test you got for the medical assistant up? Is it for Philadelphia too? So the test is national, guys. So the test does not vary by state. Okay. It does not vary by state. So whether you take the test in Virginia or California, if you're taking a CCMA, it's the CCMA, the RMA. So it doesn't matter which state you're taking a test. And now there are some states that prefers one over the other. I know, like in I think it's California where instead of it being called the CCMA, it's called the CCBMA or something like that. I don't know if it's a West Coast thing, but I know for sure I had a student, I had a study session with that was taking it in California, and it was the CCBMA. So I don't know if it's the whole West Coast or just California. But yeah, it's for any of the certifications, Kayla. So hopefully that answered your question. She said perfect. Yeah. And that's one thing too that I've done a video on, guys. So the test doesn't vary from state to state. Like sometimes I know some of you guys think about licensure. So like nurses, CNAs, providers, anybody that has to be licensed. Now you do have to be licensed in a specific state to work there when it comes to licensure. And I've heard people say, Miss K, can I use my CCMA in any state? Or whatever, like, yes, you can, because it's not like a license where you have to get licensed in that state to work there. Medical assistants are not licensed. So I want you guys to also remember that too. Medical assistants, we get certified, but not licensed. Okay. I can order the big book from you. So no, I don't have a physical book, Sharika. My course is online. Let me see if I can pull that. Let me see if I can pull that link up. I'm on here from my phone. I'm not used to being on StreamYard from my phone, but let me see if I can pull the link up. Let's see. You can easily go to marefreshercourse.com, Sharika, but I'll put the link there. So for anybody else that's wondering, so I don't have a physical book. It's all online. Yeah, and I have the clinical one, which includes both clinical and administrative practice material, study material. And then I have the administrative one that's strictly administrative. So whatever the case, you never need both. You only need, yeah, the $27. Yeah, it's not a book. It's online, Sharika. And I just put it in the chat for anybody else who needs it. But remember, guys, my online material, my study material is all online, guys. I don't have anything physical. Maybe in the future, maybe something that I do. But honestly, because of the way things are going, I may not do anything printed. I actually know someone who owns her own school, and she has study material, printed study material, and she has had people selling her material as if it was their own. And I'd rather keep my stuff online. I don't want anything physical that somebody can just copy and then hand out, because that's what was happening. They were giving out free copies to everybody at their job, And people don't realize that that's illegal. You're distributing distributing copyrighted material. So I don't know if I'll do anything printed. All my stuff is online. How do you handle the overload of administrative duties? That's a good question, Stephanie. So, taking it task by task, and I think being organized, so knowing what you're going to work on. So, let's just say you have a certain amount of administrative duties that you have to do every day. Just have it set, have a schedule set. So, like Monday mornings, or every morning, you might say, is when I'm going to respond to emails, right? And then in the afternoon, and that kind of reminds me of my most previous position. So I was assisting the clinical manager. And so I had a lot to do. Was working on a schedule, working on some of the stuff on the providers and working with the managers. There was a lot of stuff I was doing. So what I started doing is I said in the mornings, that is when I am going to focus on responding to any in basket messages that I got, emails and all of that. And then the afternoons would be when I work on a schedule. And then Tuesdays and Thursdays is when I will do like the clinical stuff. So like chart prep and stuff like that. So just having some type of schedule or day. Sorry guys, I got a lasagna in the oven I'm checking on. Um, Let me actually take I already know my service is bad downstairs. Hopefully you guys can hear me. But yeah, Stephanie, or I can't remember who, I think was that Stephanie? Yeah, Stephanie. Just make sure you have some type of schedule on when you're going to do what, because it can be very overwhelming when you have a lot on your plate. But if you set a schedule, then it helps you to not be so overwhelmed. Sorry, y'all. I know I'm all over the place right now. Let me put that in there for about another 5 more minutes. Um, so hopefully that was helpful. And then not taking on too much as well, Stephanie. So hopefully you're not taking on or volunteering for stuff that you really can't handle. So that's another thing too. Doing what you can. Don't be afraid to ask for help when you need help. Um, okay, I don't know what that is. Do I have any moderators on the oh, I know what I can do. Never mind. It's actually, is it Sherry or Shari? He said like Shari's restaurant. Is it Shari or Sherry? I'm new to the channel from Seattle. Oh, welcome. I'm glad you're here. Yeah, let me know if I'm saying it right. Sherry, like cherry, or Shari. I'm not familiar with that restaurant. Congratulations, still Magnolia. Okay, speaking said, yeah, that's where I see. So, yeah, so it's not if it's correct. I like to take notes. Okay, got you. So, Sharika, if you prefer to take notes, then you may want to go on. If are you taking a CCMA? You may want to go on NHA's website and order the physical book. Then just go ahead and order the physical book. I get it. Some people are not online, are not online studiers, or it's online doesn't work for them. So I get it. What do you think is the best thing to say when someone asks if their blood pressure is okay or if their test okay? Oh, that's a good question. So if someone is asking you how is my blood pressure, so technically we're supposed to say the provider will let you know. If your provider gives you permission to let a patient's blood pressure know, let a patient know when their blood pressure is elevated or normal, whatever, then that's one thing. But generally, you always want to refer them back to the provider. You can tell them what the numbers are, and if they say, oh, how is that? You can just let them know. The provider will go over that with you. But there's nothing wrong with telling them what the numbers are if your clinic allows that. But then whether or not you can tell them it's good or elevated or whatever is going to be up to the provider. Let me see. Any advice for new? Yes, definitely for new MAs. Absolutely. Make sure. I mean, it depends on if you mean you're starting a new job. I can't remember if you were the one that said you got a new job when I was live on the other stream. But I'll do two different ways. So for new MAs, brand new to the field, trying to find a job, and then new MAs when you find a job. So for new MAs, when you are trying to find a job, lean on your school in the beginning because you have a career services department, so you want to
get help from them with trying to find a job. Then you also want to try to look into recruiting agencies. Okay, recruiting agencies, that's going to be your best bet when you're just starting out as a medical assistant, because a lot of places want you to have experience. So you want to try those recruiting agencies and healthcare agencies. Okay. And then also, of course, I always say put on your professional clothing, go around to some offices, ask them if they're hiring and if they're okay with you leaving your resume. If you're starting a new job, brand new MA starting a new job, just always be teachable. Take your notepad with you. Of course, be on time, be early actually. Show up ready to learn. Watch some videos that are related to your specialty. So if you're going to be working in cardiology, make sure you're looking at some videos on doing EKGs and manual blood pressures and stress tests. If you're going to be working in pediatrics, make sure you're watching videos on, like, how to draw blood or give injections and, work with children. So anything that you're going to be doing on your job, you just want to make sure you get brushed up on that. And then, of course, you want to stand out from everybody else. Take initiative. Let me make sure you guys can. Okay. All right. I wanted to scroll down, make sure my sound wasn't gone again. And make sure you are, taking initiative, checking to see if anybody needs help. Never sit down. Let them tell you to sit down and take a break. You know what I mean? Um, And like I said, watch videos, stay teachable. It was something else I was going to say too. I lost my train of thought. And get plenty of rest too. Get some nice walking shoes, some nice comfortable scrubs. Be prepared. And you can be on your feet all day long as an MA. So just get some comfortable shoes. I have a video on a channel of some medical assistant must have. So make sure you check that video out as well. But it's so many things I can tell you guys as a new MA. Get to know your provider that you're going to be working with. As you get to know them more and more, you're going to know certain things that they like, certain things that they don't like, right? Hold on one second, guys. Let me, I'll still talk, but I have my AirPod in, but you won't be able to see me for a moment. So you'll get to know your provider and what they like, you know what I mean? So take that time to get to know your provider. Don't be afraid to ask questions, and don't be afraid to ask your coworkers or your manager, whoever's training you. Don't be afraid to ask them, can you watch them a few times before you do something? Because I know some people, they're afraid, they feel like they're asking too many questions, or they're asking a dumb question. No question is a dumb question. Don't be afraid to ask what you need and then ask them to demonstrate several times before you do it yourself. You know what I mean? All right, let me come back. Okay, sorry about that, guys. I had to get my lasagna out the oven. Okay, let's see. I take my good luck to you. Good luck to everybody that's taking their test. So it's Sharika is marefreshercourse.com. I'll put the link here again in the chat, but it's marefreshercourse.com. And just make sure you don't get both of them. You only need one or the other, either clinical one or the administrative one. Primary care, I'm going with it. What should I expect? So for primary care, you're going to be doing a little bit of everything. So with primary care, you're going to expect to see adults, kids, babies, right? You're going to be seeing a little bit of everything. You're going to be doing a lot of referrals. You're going to be busy because you're going to be, physicals. This is where patients come to get their physicals. So you'll be doing eye exams, hearing exams. Depending on if they already have somebody to draw blood, you may have to draw blood, or they may have somebody there to do that. Definitely a lot of vital signs. When it comes to the kids' physicals, eye exams, hearing exams, injections. If you have a doctor that sees a lot of babies and kids, you're going to be doing a lot of injections. So be ready for that. A lot of vaccinations. What else in primary care? A lot of referrals. So, this is patients go to their primary care to get referrals to see a specialist. So you're going to be doing a lot of referrals because a lot of insurance plans require that patients go to their primary care before they can see a cardiologist or neurologist or urologist. So before they can see those specialties, they're going to always come to you guys first. But the great thing is that even though it's very busy, the great thing is that you're going to see so much that you're going to probably most likely have an idea of what specialty you actually want to work in by the time you finish externship. Hopefully they're hiring, and I love primary care as a first job straight out of school. So if they're hiring, that will be great. So you can do a little bit of everything And then you can kind of decide, later if you want to go into something more specific like cardiology or gynecology. This is my first time catching live. I love you. Oh, hey, love jerkers. I'm glad you caught me live. Listen, this is a sketchy live. I will say that. I was on my computer. Service was terrible, so I had to switch over to my phone. And I'm cooking at the same time, so I've had to walk away from my phone a couple of times. But I am glad you're here. And I'm sorry that your first time catching me live has to be so hectic like this. Okay, so it is Sherry. Okay, got you, Sherry. Yes, like Sherry. Gotcha. Okay, gotcha. Will I receive policies and procedures from externship site? Yeah, you should. You can ask for a copy of it. They'll have it. They're supposed to have it, posted. If you want to copy yourself, they may even give you that, like a employee. Well, they may not give you an employee handbook as an externship, not as an extern, but you can always ask for a copy of it. And they'll most likely have it posted and stuff. A lot of that stuff will be posted like in the break room usually, because customers are required. Customers, companies are required to have certain things posted in in spaces where employees gather, usually like the break room. Refilling medications. So this is going to depend. Stephanie said advice on refilling meds. So this actually depends on your practice. It depends on how you guys do it. So my company, before the bigger company took over, medical assistants, we were allowed, the providers allowed us to send the medications directly to the pharmacy because I worked in cardiology. So patients, they were just, getting their mostly blood pressure medicines. That was the main thing they were getting filled. And then beta blockers for patients that maybe have like atrial fibrillation, right? Or I meant to say blood thinners for atrial fibrillation. Um, or beta blockers for patients with AFib also have beta blockers, and then hypertension patients also take beta blockers as well. But I meant to say blood thinners and for atrial fibrillation. So just if the provider allowed us to send it if we knew, for an example, let's say a patient needed their high blood pressure medicine filled, right? If that patient had been seen recently, they were up to date on their visits, no problem. But if it was a patient that hadn't been seen in a while, we had to send it to the provider for permission to do like a 30-day refill or a 90-day until they came in. So it just kind of depends. And then you may work somewhere where, medical assistants can't send it at all. It has to go through the provider or nurse. Once the bigger company took over the practice, then we had to do it like that. We had to go through the provider or the nurse to send it directly to the pharmacy. Like we can pen the medication and then we have to send it to the provider and the nurse, and then they will actually send it to the pharmacy. So as far as refilling meds, it just depends on your policy at your company. One thing I will say that's just a general rule when you're refilling medications, of course, you always want to verify your patient's name and date of birth. I'm assuming this is, maybe over the phone, verify, make sure you have the right patient, the right medication, of course. One thing I will also say too is when you guys are bringing your patients back, when you're doing patient intake, one great thing that will help your providers so much, especially if they like for you to do this, is to pin any medications they need a refill on. You always want to ask your patients, after you go over the medications with them, you verify their medications, you can just ask, do you need any refills today? And if they say yes, just go ahead and pin those medications. Usually most providers will like this. Of course, this is going to depend on the company, so you can always double check the policy with your company. But in general, providers do appreciate it when you at least pin the medication that the patient needs a refill on. Okay, so that way all the doctor has to do is sign it. But again, it's all going to depend on where you work. Oh yeah, DaVita dialysis. Okay, job offer working at DaVita. Congratulations, Sandra. You're welcome, Ms. Heisha. Can you ask other externship sites rather than have, ooh, I missed it. Hold on, let me go back up. The school do the process. So this is a good question. Sharika says, can you ask other externship sites? So basically she's asking, can you find your own externship site? If your school allows it, yes. So that's a question for your school. I would ask your school, Sharika. A lot of schools, I know every school that I've worked at, they allow students to find their own externship sites. However, you just have to do it in enough time to where they can get the contract signed and do what they need to do between the school and the site. So if you're going to do that and you're about to finish school soon, I would get on it like yesterday to start that process. So ask the school, and if they do allow it, just get that process started. Miss K. Hey, Sharnika, thank you for your videos. I passed my test Saturday. Congratulations. I have an interview with ENT surgery clinic. What tips do you have for me, if any? So for interview tips, guys, make sure you are able to answer questions like, tell me about yourself. Be able to introduce yourself. My name is Sharnika. I'm a recent graduate of such and such school. I recently became a certified medical assistant. Be able to answer questions about yourself, and also be able to answer why they should hire you. Okay, be ready to answer what your strengths and your weaknesses are. I think for a lot of people, strengths are easy to name, but sometimes when it comes to weaknesses, those are a little bit more difficult. So think of some weaknesses. Okay, some things you may need to work on. Not that you need to work on being on time. You don't want to use it as a weakness, like, oh, I need to work on being on time for work every day. Don't use that. But I mean, like something like I always use this example because this is a strength, but it's also a weakness. Like a strength is like being very empathetic, right? You love your patients, you have compassion for them, you're very empathetic. And the weakness, right, could be I'm so empathetic, sometimes I have a hard time separating work from my personal life. Sometimes I can go home and think about my patients, you know what I mean? So that's a weakness, is having a hard time separating it. So that's something like that where you can turn your strength into a weakness. So be able to answer that. Also have some questions when you go. Get there early. First of all, that should have been the first thing I should have said. Get there early, be in the parking lot. If you get there early, at least you out there waiting to go in, okay? Take some copies of your resume, all right? Have some questions to ask them when they say, do you have any questions? Never say no. Always have something to ask them. Look up the company. Know who you're about to work for. Don't just go and work for a company just because you need a job. Look them up. Who knows? I was about to go work for a company the whole time. Not, I wasn't about to go work for them, but I was going to go to an interview with them. And I realized it was just something that I just could never do. I won't get into it here, but it was just something that I was like, I didn't even realize they did this in this facility. I know I can't be a part of it. So guess what? I said, you know what? Let me cancel this. It's just because of the specialty. I like that specific specialty. And I was like, oh, okay. But then when I realized some of the things they do there, I was like, you know what? I can't. So make sure you know who you're going to interview with. Um, so I've never actually worked in dialysis, especially on the administrative side. I know on the clinical side, you want to be up to par on your phlebotomy skills, but I've actually never worked in dialysis. But I can give you administrative assistant tips in general, just making sure. And that goes back to some of the tips that I just gave the other person. If you're just starting, getting there on time, asking questions, make sure you have a notepad. You can look up videos on some things that you may have to assist with as an administrator, as a medical administrative assistant in a dialysis center. Some of the check-in processes that you may have to do, and then just stay organized with your duties that you have to do. Any tasks that you have it set up to where every morning this is what I'm going to work on. From 8 to 10, I'm going to check my emails. From 10 to 2, this is when I do this, or this is when I do that. You know what I mean? And then of course you want to be answering phones and probably making appointments and stuff like that. But I mean like your daily tasks that you do in between, because you're gonna have some tasks in between that. So that's one thing I will say, is make sure you are working on your multitasking skills, because you will be dealing with patients most likely. You'll be dealing with patients, and then in between that you'll still have other duties to do, pulling the schedule for the next day, maybe even calling to confirm appointments, right? There's always going to be something else that you have to do. So look into what it's like to be a medical administrative assistant in dialysis. Are we allowed to apply as an MA? Oh yeah, during externship, absolutely. Yes, you want to apply. Ask somebody hiring. You definitely want to apply. Absolutely. If they're hiring, absolutely. If they're hiring and you're doing a good job, you may not even have to apply. They may just offer you the job, but absolutely you can apply. So when you get there and I wouldn't ask necessarily on the first day, but just get in there, start doing well, especially if they start complimenting you on how well on how well you're doing. Then you can say, are you guys hiring? You know what I mean? Um, Sorry, I just had a text message pop up. Let's see. Hey, is that Chine Sharon? I'm new here. Welcome. I'm glad you caught me live. Do you have any tips on staying the medications or how to find the? Oh, okay. So this is a good question. Lynn Love Game said, "Do you have any tips on staying the medications or how to find the known name rather than the generic?" So there's always going to be, of course, Google, guys. You all, and then we have like, resources like Chat GPT now. Even when you go to Google and look it up, certain things automatically populates for you. But you can always also go to pdf.net. No, I said pdf.net. It's oh my goodness. It's the medication site. Why am I saying pdf.net? It is oh my goodness, y'all. I done forgot the website. It's the medication website, y'all. Why can't I remember the site? Y'all, I done did save so many PDFs today that I'm thinking about PDF. What is the site? It's for medications. Anybody know the site? Put it on the chat, please. But it shows the pronunciations and medication, so you can do that. And then also try to focus on the specialty you're going to be working with. So I don't know, Lynn Love Gammon, let me know the context you're asking. And are you in school or is it for the specialty? If it's for the specialty you're working in, just focus on those medications. Like you guys know, I work in cardiology, so I created a tip sheet for medications. It had all of the medications, the brand name and the generic, is along with the pronunciation. I printed that out for the medical assistants at my job. So if it's something like if that's what you're asking about, focus on the specialty meds. If you're in school, flashcards, medication on one side, the brand name on one side, and then the generic, and you can also have the pronunciation on there as well on the back, or however you want to do it. You can have the brand name and the generic on the front, pronunciation, and then on the back you can have the use, the class, any contraindications or precautions or whatever. So either way, whether you're referring to the specialty or you're a student, one of those that I just mentioned will apply. Still processing for nursing school. Awesome. Good luck with that. I'm taking my CCMA. Samar says in 720. Can you give me some advice? And Samar, you are enrolled in my MA refresher course, right? I remember you from the other day. So you're taking yours on July 20th. So the in my MA refresher course, so when you scroll all the way down to the end in the handouts and resources section, you'll see the CCMA test plan. Make sure you're using that. So as you're going through the MA refresher course, when you go through each module, so let's say like the first module, foundation of medical assistant, right? That's where you learn things like how, the medical assistant scope and all of that. Anything on the test plan that says something about the scope, you check it off. So use it as a guide as you're going through the course. So same thing for like medical terminology and anatomy, right? On a test plan, it'll say something like you got to know the structures of the reproductive system, just using it as an example. Once you learn that on the MA refresher course from that module, check it off on the test plan. Use the test plan as a guide. Everything you know, check it off, highlight it as you learn it. And then by the time you go through the refresher course, anything you did not check off already, you need to go back and watch it again to learn it, right? Or whatever other study material you have. And then of course you can always send an email when you need your quizzes reset. You can always send an email as well, and just use that test plan as you're going through the course. So same thing for you, Elise, for people that's asking for tips. And I have a playlist on study tips, guys. Make sure you have the test plan. I mentioned that in there. And then what else? Having a study routine. Um, what else? Let me see. I'm getting stuck because this is the number one question that I always answer. That's why I created a playlist, because this is the number one question that everybody asks. So you kind of get, when you got to say the same thing over and over, you could just kind of get stuck sometimes. So I just tell people, just go to the playlist. And then a test plan. That's the main thing. I will tell you guys this, that's about to take your test. Make sure, again, when you guys are actually on a day, make sure you're flagging the hard questions and then coming back, at the end. Go through all your easy questions. Anything you got to sit and think about when you're taking a test, flag it or bookmark it, and then come back to those at the end. Thank you. I've been practicing those very questions. I'm doing those. Okay, good. Yeah, Sharika said, good question, Lynn. Yeah, that was a good question. I'll probably turn, not probably, I'm pretty sure I will make that into a clip. Okay, let me scroll down. Let me see what else you guys are asking. So Good RX is one of them. It's the medication. I'm thinking PDF, but it's not PDF.net. It is the medications. It's a position. Oh, duh, PDR. I had to say the word. Physician's Desk Reference. PDR.net. Physician Desk Reference. PDR.net. You can go to a site like that for the medications as well. But you can get, if you go to that site, you may possibly get a little overwhelmed because there's so many. So you can always try. Natisha mentioned GoodRx, and then of course Google, and then um, chat, like sites like chat as well. Miss gonna have an interview tomorrow. Good luck with Urgent Cares Medical. Good luck. I just gave some interview tips. I'm a new MA in family medicine. Ooh, so we do quite a few. Yeah, thank you for sharing that, Lynn. When you're in family medicine, you're seeing that the kids, the adults, babies, geriatric patients, ain't no telling what you want to see in family medicine because they do, family medicine is usually the primary care office. So you're the one that everybody has to come to. You know what I mean? It gets really busy. Um, how to stop being awkward with patients. Practice, really. When you're first starting out, you're going to be nervous and stuff because it's a real patient. I will never forget the very first real patient I interacted with after school because you're so used to, being in class with your classmates. Oh, where's my I forgot I had this, y'all. My frozen Coke is all liquid now. But you're so used to being with your classmates that when you get with a real person, it's going to be awkward. But just practice. The more you do it, and you can even be honest with them about being brand new to medical assistant. Like you can say, I'm a little nervous. I just got out of school. That's what I did. I was like, I'm brand new medical assistant. And they're pretty, most patients are pretty understanding with that. Even when I had to draw blood for the first time, I told the lady, I'm like, I've done it in school. I'm good. But you're the first actual patient that I'm doing. And she was very patient. She was like, okay, you got this, so you never know. Patients can be very encouraging. So it's just going to come with practice. Looking at some videos on patient intake. I have one on the channel on patient intake and practicing with someone at home. So if you have someone that you can practice with, a friend or spouse, or if you have a kid that's old enough, you can practice with a friend, family member, whoever. You can do that, and like I said, watch some videos. But it's really going to come over. It's going to come over time to where you're not as awkward, but it is going to be a little awkward in the beginning. I'm just being honest. Even sometimes for me, I've been in the field over 20 years, and I've still had awkward moments. So even though you guys see me online, I'm talking to you guys on here on live, I teach, I'm standing in front of students, I feel like I'm actually socially awkward. Like it's different when it's one-on-one. Like if you, a matter of fact, I ran into a girl at Walmart. So y'all, I recently moved to Georgia, and I finally ran into somebody while I was out down here, because it happens in DC a few times. Quite a few people recognize me in DC back home, but this is the first time happened in Georgia. And even meeting her, like she was happy. I was happy to meet her too. But I have a little social awkwardness as well when it's one-on-one. I can speak in front of 1,000 people, but when it's one-on-one, it's a little different. So I get the awkwardness, but just just practice. You're welcome, Lynn. I have a question. When I did the first interview last week over the phone, it was said that my certification as medical assistant isn't required. So would it be good for me to still? Absolutely, yes. This is a really good question. I got to make sure I clip this as well. CH says, I have a question about the first interview. They said that the certification is not required. Should I still take it? Yes. Even though the job you're interviewing for says it's not required, absolutely still take your exam. Why? Because they could require it later. A new company could take over, You could get another job that requires it, right? Take it now while it's still fresh on your mind. I always tell you guys, do not wait to take your test. Take it while it's fresh. So yes, absolutely still take your test. And this goes for anybody. Everybody that's on here that's wondering, do I need to take it? I have a job that's willing to hire me. Absolutely. I have people come to me who've been in the field up to like 20 years, never needed certification, and now all of a sudden they need it. Why? Because they went to a new company, or their new company was acquired by another one. I can't, let me tell y'all, if y'all work for a private company, you stand the chance of it being acquired by a bigger company, especially since COVID. A lot of people are being acquired. So listen, get certified while it's still fresh. Even though the one job might not need it now, you will need it in the future. You will. I won't even say you might. You will. If you want to continue to be a medical assistant, you're going to need it. Good question. Thank you, CH. The study plan, Samar. So in the course, and this is for anybody who has my MA refresher course. I have the study plans at the end. So at the very end, so Samar, you know how it's 12 modules, right? When you scroll past the 12th module, there's another space that says like handouts and resource. It either says resources and then handouts, or it says handouts and then resources. But just look for handouts or resources, and you'll see the test plan. You'll see a bunch of things uploaded. If you scroll all the way to the end, it's going to say NHA CCMA. You're going to see the test plan for the RMA, CMA, CMAA. Just make sure you're downloading the CCMA study plan. But it's all the way at the end. And then Samar, if you can't find it, you can always just go to Google and just do CCMA test plan to download it from there. To Queen or TA Queen or to Quinta, will it be easier to get a job once becoming a CCMA? I completed externship and graduated in 3 weeks, but I'm gaining any. Okay, yeah, yes and no. So, like I mentioned, some companies will hire you without it. Some of them will even give you time to get certified. So they'll say, we can hire you, but you need to get certified within 90 days or 60 days or whatever. So yes and no, because I say no because like I said, some will hire you, but yes, in the sense that yeah, there are a lot of companies that absolutely want you to be certified. And so just reach out to some recruiting agencies, and that's going to be your best bet, especially being fresh out of school. You graduate in 3 weeks. Try some, look up medical assistant recruiting agencies and healthcare agencies, and of course, Indeed. Chloe says, I'm new to your lives, but I've been watching videos for a while now. Oh, Chloe, I'm glad you were able to catch me live tonight. Welcome. And thank you for watching the channel. Guys, I appreciate you guys for watching the channel. I just made 100 subscribers. I wouldn't have made it without you guys actually subscribing. So I thank you guys. Do me a favor, if you haven't already, make sure you like the video, not just within the chat, but the actual video outside the chat. And if you see the option to hype it, hit that. That is just a quick and easy, free way to help me and help my channel, because when you guys like the videos, it pushes it out in the algorithm. And also, people that want to see stuff like this, it will make it more visible to them. You know what I mean? So I appreciate you guys for being here. Yes, the exam is only written. Somebody says, is the exam only written? Yes, it's only written. And she says, so the externship is for experience and skills used as hands-on. Yes, great question. Shrika says, so the externship is for the experience and skills used as a hands-on test. It is. It's like another part of your course. So for some programs, you have to have externship to even be a medical assistant. Like you can't even you're not even finished the program if you don't do externship. So it is like your hands-on, like a hands-on test, if you will, because like one of my schools, students got a grade for externship, right? And then some schools, they don't require it. But yes, it's for your experience. Also a part of the curriculum for most schools. You also want to add it to your resume. So for those of you that's about to go on externship, it was a couple of you guys that asked me for externship tips. If you guys are still here, make sure you add your externship to your resume, because it is experience, even though it's only 4 to 6 weeks, a certain amount of hours. I don't care if it's 2 weeks, add it to your resume. Everything you do on externship, make sure you add it to your resume as a skill that you have, and also as a duty that you perform while on that externship. Okay. Hey, Chloe's watching from New Mexico. Awesome. Is it easy to take the test online? No, do not. If you mean like taking it from home, absolutely. Either way, the test is online, so you got to take it online. But if you're asking to take it online from home, no, don't do that unless you absolutely have to. But they are very strict when you take it online. They will cut you off for any little thing. Um, but if you mean like just online in general, yes, it has to be. Sorry, guys, that's my ice maker in the back. You hear? Yeah, it has to be online anyway. But if you're asking, can you do it from home? You can, but I do not. I highly don't recommend it. Highly don't recommend unless you absolutely have to, because I can't tell you how many people I know that took it at home. Any little noise, any little thing, they will cut it off, and guess what? You have to book it all over again. Um, so I recommend going to take it at a testing center. Oh, Sharika, is that you saying bye? Okay, have a good evening. I see the hand. I think it's just like a waving. So if you are, thank you for hanging in it with me, Sharika. Do you look over resumes? I don't. I used to. Only time I do briefly is if you like doing a one-on-one. I can't even do it on a one-on-one because it's only phone calls. I used to, but I have people that know how to do resumes in my group. The MA specialist, if you're on TikTok or on Facebook, Instagram as well, she's everywhere. If you look up the MA specialist, her name is Jasmine. Let her know I referred you. She does resumes and she's good. She be having specials sometimes for like $10. So so look her up. I don't really have the capacity to do that anymore. I used to when I first started this channel, but I can't. It became too much. When I do study sessions, the group study sessions, I can in that moment, but uh, generally no. Yeah, Miss Jasmine. Yep, Jasmine, the MA specialist. Her name is Jasmine Coleman on Facebook, and then everywhere else she's the MA specialist. Oh, Sharika said no. I was saying how. Oh, sorry, Sharika. I'm like, I see the hand. I'm like, is she saying bye? Okay. She said, my test is scheduled for this Thursday morning. It's within watching your videos. I'm confused why I need it. That's how the scoring model is. She said I'm confused why I need it, but that's how they do. The CCMA is 390 and up. The RMA is the only one that has like that scoring system that you guys are probably used to. Like you need like a 80% to pass. Um, but the other exams, yeah, that's just their scoring model. CCMA you need a 390. CMA you need a 405. That's just how they do it. You're welcome, CH, and anybody else who had a question. Oh, y'all, it's been 43 minutes. Y'all been hanging in there with me. Let me know what else y'all got for me. What other questions y'all have for me real quick. I'm gonna get off here in a few minutes. I'm gonna mute myself really quickly so I can call up to my daughter and let her know this food is ready. Hold on 1 second. Okay, she didn't hear me. Let me know y'all can hear me. She didn't hear me. She probably sleep, y'all. My daughter's expecting, so she don't do nothing these days. She just turned 8 months today, and she don't do much these days, but eat and sleep pretty much. I don't know. For those of you that's on here and y'all have kids, y'all know how it is when you get toward the end. The closer you get toward the end, it's like you just sleepy. I mean, she gets up, she's active and stuff like that, but for the most part, she is sleepy. And I remember when I was pregnant with her, I remember feeling like I could sleep for days. Like if I didn't have nothing to do, I felt like I literally could have went to sleep from like Monday to like Wednesday and just been asleep. My stomach growling, y'all. I feel like I could have just been. I feel like I could have just slept for days. So I know that feeling. What is the name again? Yeah, Jasmine Coleman. I think Jasmine is with a Z. Jasmine Coleman. But just go to Google. I'm not Google. Go to I'm putting it in the chat. Just go to TikTok um and Facebook and look up the MA specialist. I just put it in the chat for you, CH. And her name is Jasmine, and just let her know I sent you to her. Internal medicine, recently got a job at a endocrinology clinic. So advice for working in internal medicine, you recently got a job in endocrinology. Okay. So internal medicine, most likely going to be a primary care office as well. A lot of referrals. Probably going to be doing, physicals, assisting with some minor things. Did I mention referrals? A lot of referrals to specialists. Not much to working in internal medicine. It's similar to family practice in the sense that it's primary care, but they, it's going to be adults. Um, so same advice that I just gave for family medicine, except you won't be doing vaccinations on kids, but you may be doing some vaccinations, like flu shots and stuff around that season. Tetanus shots and things like that, pneumonia shots and stuff like that. So yeah, I just gave some advice on that a few minutes ago. Oh, Stephanie, it's the same per. Oh, okay, that's you, Stephanie. So same thing I said earlier. Really, just the only difference, you just won't be, um, having the babies like family practice. Thank you, Sharika. Okay, guys, I'm gonna go ahead and get off here. You guys literally hung in with me all this time. I literally, if my stomach wasn't growling like it is, and I wasn't uncomfortable, because y'all, I'm literally in my kitchen right now. I'm literally sitting here at this computer that I couldn't use because of the service, the internet service, and I'm ready to go upstairs. So I'm gonna get off here. How many facilities do they have in Georgia? I live in Georgia, and they say it's about 2 hours away. Oh, wow. I don't know. I just moved to Georgia, love triggers. I have no idea. I have to look into that myself because my daughter has to take a test soon. So I don't even know. I got to figure that out. I got to figure out where she want to go take her test, because I already told her, don't take it on here. Don't take it here. Our internet is already, sometimey, and nah, I'm not taking that risk. So I don't know. I have no idea. You have to look it up. How many PSI testing centers in Georgia? Dang, 2 hours away. Sheesh. What part of Georgia are you in, Love Driggers? You're welcome, Sharika. Sharika says, thank you for the live. You are welcome. Thank you for joining. You too, Lynn. Thank you. Thank you, guys. All right, y'all. Y'all have a good night. I will see you guys in a couple of days.